Good afternoon, everyone. This is Saurabh Arakelian, your clinical pharmacist. Welcome to another episode of Pharmacy Talk USA. Make sure to subscribe to the channel to receive daily notifications on medication news and updates. So, what are the top drug interactions out there with common medications? In this video, I'll be talking about the top 20 drug interactions with most common medications that many may not be aware of and you should watch out for. So let's get into the top 20 drug interactions that you should know about. Blood thinners. When it comes to warfarin with NSAIDs or aspirin, if you take them together, combining them may increase the risk of bleeding. So it's very important for you to know if you take warfarin and you take aspirin or NSAIDs, such as ibuprofen for pain, they may increase the risk of bleeding with warfarin. The next interaction is warfarin with vitamin K rich foods. So to avoid reducing warfarin effects, patients should avoid consistent high levels of intake of vitamin K, including green leaves, green leafy vegetables. So the more of those vegetables and green leaf products or vitamin K products you take, the warfarin effects will go down. It will be reduced. Then warfarin with certain antibiotics such as ciprofloxacin, Clarithromycin, Erythromycin, Bactrim. Some antibiotics can alter the blood levels of warfarin, increasing the bleeding risk. This is very important when you're on warfarin for regular as a regular routine medication, but you get infections and you get put on any of these antibiotics. You should watch out during that 10 to 20 days of taking antibiotics for increased bleeding risk. Then we get into the cardiac medications, statins, such as Lipitor, Crestor, statins for dyslipidemia, for cholesterol medications, and grapefruit juice. The combination can increase statin levels in the blood, potentially causing severe muscle pain, liver, or kidney damage. So again, if you're taking cholesterol medications, you should be avoiding grapefruit juice when you take them, when take the medication. ACE inhibitors and potassium supplements, combining these can lead to dangerously high potassium levels. So again, ACE inhibitors like lisinopril, benazepril, if you take them, they may increase with potassium supplements, and the levels of potassium may go severely high. Then we get to central nervous system depressant medications, benzodiazepines such as Valium, diazepam, alprazolam, Xanax, with opioids. Combining these can cause severe drowsiness, respiratory depression, and even death. So if you're taking any of these anxiety medications and you add a pain medication to it, you should be watching out for severe respiratory depression and drowsiness. Alcohol with many medications. Alcohol can amplify the sedative and other effects of many drugs, increasing risks of extreme drowsiness, dizziness, and slowing the breathing. So you should definitely avoid alcohol as much as possible with any medications you take, especially with benzodiazepines, with opioids, and some of the antibiotics. Common interactions with regular drugs, levothyroxine and omeprazole. Omeprazole can interfere with the absorption of levothyroxine, reducing its effects. So when you take levothyroxine, number one, they always recommend to take the levothyroxine on empty stomach in the morning. But if it's not the case, then with omeprazole for heartburn, omeprazole can reduce the effects of levothyroxine and change your thyroid levels. Antacids and certain other drugs. Antacids can bind to other drugs in the intestine, preventing them from being absorbed and working properly. So if you buy any over-the-counter antacids for regular use, they may interact with your regular medication. So it's always recommended to keep antacids or calcium-containing antacids away from all your other medications. We have SSRIs and NSAIDs, the combination of selective serotonin reuptake inhibitors like Zoloft or Prozac and NSAIDs such as ibuprofen can increase the risk of GI bleeds. So again, it's very important for you if you're on SSRIs for like Zoloft or Prozac for diseases such as depression. If you take NSAIDs with it, you need to be watching out for any kind of symptoms of GI bleeds. If it may happen, to refer back to your physician for advice on the continuing of any of these medications. We have other common interactions such as fluoroquinolones, antibiotics such as ciprofloxacin, plus divalent or trivalent sucralfate or carafate, as many of you guys know, decreases the level of fluoroquinolone. So when you take antibiotics like fluoroquinolones, taking carafate with it may it reduce the effects of fluoroquinolones and not let it work for the infection that you're taking it. Carbamazepine tegretol plus cimetidine, erythromycin, clarithromycin, or fluconazole, they all increase the levels of carbamazepine. So this is something to watch out for when you're taking carbamazepine. Adding any of these medications, cimetidine, Tagamet, erythromycin, clarithromycin, fluconazole, may increase the levels of carbamazepine. Phenobarbital plus rifampin. If you're taking phenobarbital, rifampin will decrease the levels of phenobarbital. So it's something to definitely watch out for if you add rifampin to the phenobarbital. Lithium plus NSAIDs or diuretics, they increase the levels of lithium levels. So if you take lithium on regular basis or for various conditions, if you add NSAIDs temporarily or diuretics for blood pressure control, you should know that these two may increase the levels of lithium in your body. Phenytoin, dilantin plus cimetidine, erythromycin, clarithromycin, and or fluconazole increases the levels of phenytoin. So just like phenobarbital or carbamazepine, when you take phenytoin on regular basis, routinely, adding cimetidine, erythromycin, clarithromycin, or fluconazole as an antifungal medication will increase the levels of phenytoin. Some other interactions, sildenafil Viagra plus nitrates will cause severe low blood pressure. This is very important for you to know if you're taking Viagra and you add nitrates for various cardiac reasons. This may, in combination, will cause severe hypotension, which is severe low blood pressure. Lovastatin Mevacor plus Warfarin increases the effects of warfarin. Again, lovastatin as a cholesterol medication, if you add it to the warfarin, it will increase the effects of warfarin and it may cause bleeding. SSRIs such as Prozac or Zoloft plus tricyclic antidepressants, they increase the tricyclic antidepressants levels. SSRIs plus tramadol for pain increases potential for seizures and serotonin syndrome. So again, if you're taking SSRIs on a regular basis for depression and you add tramadol for pain, it will increase the potential to have seizures and or serotonin syndrome. So if you have any of these symptoms, you need to stop the medications and contact a physician. Lastly, SSRIs plus naratriptan, rizatriptan, sumatriptan, and zolmitriptan, which are all for headaches, migraines. If you're taking them with SSRI, again, they may cause serotonin syndrome. So again, these are medications, top 20 drug interactions that many people encounter. Many people take these medications. Fortunately or unfortunately, they have to take them at the same time. They may face these interactions, which is why it's very important for you to know about. And if you experience any of these symptoms, to refer back to the physician. There are other also interactions such as ciprofloxacin with diet, with dairy products that you should be avoiding for ciprofloxacin to be absorbed better. Again, as I mentioned, warfarin with vitamin K or green leaves or vegetables. If you're trying to lose weight and you eat more vegetables, while taking coumadin warfarin, it may affect warfarin's levels in the body. So for more detailed information on these interactions and any questions, make sure to comment on the video. with your questions, and I'll be happy to answer any questions you may have on these top drug interactions. Hope you enjoyed this video. As always, stay safe and take your medications.